Hi, my name is Dr. Nicole Klein, and I am an associate professor in the health education program at SIUE. And I'd like to talk to you today a little bit about our program here at SIUE. So, if you are a little bit interested in health, maybe you've taken a class or maybe you've heard from somebody else about health education, the program here, I have a couple of questions for you to ask yourself to see if you might be a good fit with this program. So first question is, do you like to work with people? Health educators tend to work, instead of working with things, we work with people. So if you're somebody who maybe describes him or herself as a people person, you're kind of interested in the way people think, how do people tick? This might be a good fit for you. Second question, are you interested in health? I mean, that seems kind of basic considering it is a health education program. But, do you find yourself sort of drawn and interested to things like, nutrition or drug and alcohol prevention, abuse prevention, or sexuality, or injury prevention? If something like that really kind of makes you interested, this might be a good fit for you. Next question is, do your friends ask you for health advice? So it could be maybe you're in a health education class, like a personal health class right now. Are you the person who, kind of comes home and shares that information with other people? If so, you might already be kind of acting as a health educator, and that might give you a key for this field might be a good fit for you. Next question, do you want to make a difference in people's lives? This field is all about helping people. There's nothing more basic than someone's health. It's really hard to enjoy anything else if you don't have positive health. So if that's kind of you, if you kind of feel that pull or that calling to make a difference, this is a great field for that. Last question, are you interested in a major that has a faster than average job growth? And health educators actually we're seeing growing by the year 2022. It's expected that hiring in those fields is going to grow by 21%, which is quite high. If you are interested, like if you're in a current major or you're interested in a different profession, I highly recommend that you go to the website for the U.S. Bureau of Labor Statistics and look up the profession that you're looking at. It will tell you things like what kind of training do they need, what do people do in that profession, and really a key piece in there is it will show a job projection. It will show, okay, over the next several, next 20 years, next 10 years, next 20 years, what sort of job growth do we see? Is it going to remain steady so that, the kind of the same number of people are going to be hired in that field? Is it going to decline, meaning jobs are going to be harder to find in that field? Or is it going to increase? So you want to see that it's going to increase, because clearly if it's going to increase, then you're going to have more job opportunities, more flexibility, hopefully a better salary. So out of these questions that I've posed, if you were able to answer, 3, 4 of them, maybe all of them with a yes, then you might be a really good fit for community health education, for that to be your major. So what is health education? It's one of the core areas of public health, and health educators really focus on individuals and communities, doing hands-on things with them to help maintain their health. So preventing disease and disability, or doing early detection so that whatever disease or disability that they have is going to be a lot less of a burden. Really, prevention is the key. We work a lot on preventing situations, because preventing diseases and disabilities, it's a lot cheaper, both emotionally and financially, and societally, than it is to try to cure someone who already has the disease. So I talked a little bit earlier about some of those health behaviors. So we focus on certain health behaviors: exercise, nutrition, weight control, alcohol, drugs, and tobacco, domestic violence, sexuality. We have a big focus on mental health, an issue that's becoming more and more important in the U.S. As we learn, we really probably don't do a great job with doing mental health, both treatment and prevention in the U.S. Safety and injury prevention, disease and disability prevention, I kind of talked about that a little bit earlier. Environmental health, so natural and man-made disaster preparedness. So, how do you make sure that you have a community prepared for tornado or an earthquake, that sort of preparedness. And then finally, global health, really looking internationally, what's the picture when it comes to health education, prevention, diseases, disabilities. The program actually offers a travel study program where students will go to another country, typically for, I mean, it depends on the program, but like say, for example, this past summer, we had students go to Ghana, Africa for 5 weeks and implement programs there. So students really love that and they learn a whole lot from it. And that's an option for health education majors. So what are you going to learn? Well, you'll learn to plan, implement, and evaluate a variety of health education programs. Very hands-on. The whole program is very hands-on. So typically, if you're going to learn something in a class, we are immediately going to have you turning it around to figure out how would you use that in your profession. So if you're the kind of person who likes a lot of examples, who likes to do things to immediately kind of understand why you're learning something, and then immediately see how that applies to helping people, this is a good place for you. Skills and experiences to increase your marketability and leadership qualities. There are sets of things what employers call soft skills that are really important in who they decide to hire. So who can get along with other people, who can work on a team, who can have some of those leadership skills. So we work a lot on those in the program. Then your final semester, right before you graduate, we work a lot with students in their senior seminar class on how do you market yourself. So how do you kind of make that transition from being a student to then being a professional. We have a very high rate of students becoming hired right out of their bachelor's program in their field, so in their trained field in health education. And part of that really, I think, is that they are so well prepared when they go out. How do you interview? How do you network? What sorts of skills have you developed in the program that you can put on a resume or explain to somebody? Skills for health promotion and disease prevention advocacy. That's really important. So looking at, what's going on in Washington, D.C. that has to do with health, public health, and health education. What's going on in state capitals? What's going on in nonprofit organizations? And really being there to kind of advocate and say, this is important to public health. Here's what we'd like to see when it comes to funding or research, for example, or legislation. Then developing social marketing and mass media campaigns in health education. This is key. It is inexpensive and you can reach a lot of people through social media. So we focus on that, learning those skills. Participating in a very active national honor student organization called Eta Sigma Gamma, which we call ESG. They do all sorts of activities, programs. They're sponsoring the Madison County Youth Forum. So all sorts of hands-on things that you could become involved with if you're a student. There is a GPA requirement for that. I believe you have to have a GPA of 2.7 or above to be in the Honor Society. And then finally, you're prepared at the end of the program to take the Certified Health Education Specialist exam, the CHES exam. And this is something that we see on jobs, that we'll see an employer might list on the job requirements that someone either be CHES certified required or CHES certified preferred. So you are able to sit for this exam. It's not required that you take it, but you can sit for that exam. And we have a very high pass rate with the students who take it, who've graduated from our program. So what do health education grads do? So you may be thinking, okay, what do you do professionally? They work in a variety of settings. So, kind of as you can tell from this list, nutrition educator at Mizzou, a clinician at Chestnut Healthcare Systems working for Tobacco Free St. Louis, which is a nonprofit organization. People could be working in hospitals. People could be working for nonprofit organizations like the AIDS Foundation Houston, working for American Red Cross. It really varies. And you'll see that there's really a wide variety of skills that employers are looking for that our health education graduates have. So if all of that sounds interesting to you, you may be curious about how to declare. So here's your step-by-step. First, you have to complete English 101 and 102 with a grade of C or better. And that really is because you're going to be doing quite a bit of writing. Program planning has a lot of writing that's associated with it. There are research papers that you're doing. You may be writing pamphlets or websites or something like that. You do need to have good writing skills for that. Grant writing in particular is a a skill that's in high demand with employers. So that's something that is part of the program as well. You have to have a minimum GPA of 2.5. And then this is an interesting part of our program is we understand that sometimes people start in a different major and then realize, oh, maybe it's not such a good fit, or they discover health ed and realize, okay, that's what I want to do. So we make sure that there are 15 credit hours that you can transfer in from another major. So if you started in one major, you can switch and not lose all those credits. Or if, let's say, you are interested in health ed and then you want to kind of maybe take some business classes as well, which actually is a really good mix, then you can do that. So if all of that sounds interesting, what you need to do is contact Monica Kempland, and I've given her email address and her phone number on here, or Michelle Jenkins, and her information is on here as well. I will there to learn more about the program. I'll put some links in the comments underneath this video that you can click on that will bring you to the website for the program, that will tell you a little bit more about what health education specialists do as well. So I hope that gave you a little bit of an overview, and that I've answered some of your questions, and I really hope to see you in some health education classes in the future. Take care.